The coronavirus outbreak leaving many San Diegans worried about it spreading here.
Supervisor Nathan Fletcher joining us now with how county officials are trying to ease the fears. Nathan, good morning. Thanks for being here.
Thank you for having me.
This is on everybody's agenda. Yep. This is what everybody's talking about, all levels of government. What are you guys doing?
Well, we started in January. In January, we said, hey, we fear that this could have an impact on our community. And we immediately put in place a series of protocols, daily calls with CDC, with public health officials. And we were one of the first local jurisdictions to declare a public health emergency, a state of emergency, not to cause panic amongst the public, but to reassure the public that we take this seriously and we're doing everything we can. And those efforts continue to this day. We've identified 8 sectors as county government we're engaging in daily, particularly our most vulnerable populations, our senior centers, our congregate care, our health care settings. Today we'll be convening a special meeting in the Regional Task Force on Homeless to talk about what we're going to do to try and protect the unsheltered population. The reality is this is going to get worse before it gets better. And everything that we're doing now is to try and mitigate the spread, try and lessen the impact, and really remind folks that there are things within your control that you can do. And I know at times folks get tired of hearing it, but seriously, wash your hands. And if you feel sick, stay home. And if you have vulnerable populations or communities, make sure you look out for them and try and help them. And then we'll continue to do everything we can from a county government in partnership with city and state and feds to try and lessen the impact.
Yeah, Nathan, I know we have very minimal cases right now confirmed in San Diego. And as you said, everybody's expecting those numbers to change and increase as the testing comes out. On one hand, we hear, don't panic.
Yeah.
Going to be okay. And then on the other hand, we have lines going out of Costco for toilet paper, water, and events canceling left and right without the county coming forward yet and saying cancel events, but people making those decisions.
Right.
What somebody's watching right now, who do you listen to?
Well,
who
and
do you follow?
look, I trust. We have an incredible team at the county of public health doctors. They're experts in infectious disease. They train for this. They plan for this. They prepare for this. And I really do trust their guidance, and I do trust their judgment. And so when they say this is something that is serious, this is something that is likely to spread, this is something that's likely to have an impact, I think that we have to take that seriously. And I think that individuals are making decisions for how much it's going to impact their lives. But at the end of the day, a lot of the things that we're encouraging people to do, have an emergency kit with 2 weeks of food, that's stuff you should do anyway. Mm-hmm. That's stuff we talk about for earthquakes and for fires, and a lot of the things that we're talking about for coronavirus. Get a flu shot. If you feel sick, stay home. Those are general good health practices that we need to do. And so I take seriously the risk and the danger. We keep it in perspective. We make fact-based, science-based decisions. But those decisions have led us to push to do everything we can to engage with every sector. We're in the process of setting up hand washing stations.
Yeah, we noticed that yesterday.
Public health nurses that are out.
The decision for these hand washing stations, how do you know that when you put those out, they're actually being used by the people you want using them? Because that's half the battle is, okay, you can put them out there and it looks great, but are they using them?
Well, and this goes into public engagement. So we're putting them out, we're engaging with folks. I feel like everyone in America should have heard the wash your hands message by this point. But, we're going out with foot teams to engage with homeless populations, to provide them information, to talk with those folks, to walk them through what we're doing. And there will be hundreds of hand washing stations set up at transit stations. MTSs request them at every transit stop. We're doing them for cities that request them. We're looking at sheltering potentials and opportunities for folks who may test positive or be a person under investigation but can't go home. Don't have that as an option. How do we isolate those folks, quarantine those folks, treat those folks? We're in daily communication with our hospitals. And so I believe that every day we wake up and say, what else can we do to protect public health? And if it's one life that gets saved, then the effort's worth it, because every life matters. Every life matters, regardless of your age, regardless of your housing status, regardless of where you are, and we want to make sure we protect public health.
And honestly, we're all in the same boat with this, so we're 100%. All need to do our part. Thank you, Nathan Fletcher and the county for doing yours.
Absolutely.